Now let's go to the treatment options, and I have a whole tray of all the different options here, which is great. I mean, it's great. There's so many different ways that we can store sexual health in men. We have so many tools in our toolbox, and we're going to go through some of these. So, I use pills in most guys if they haven't tried pills before, as long as they're okay to take pills. So if they, have to take nitroglycerin or significant cardiovascular disease, where I don't think they're a candidate for the pills, then I can't use them. But otherwise, yeah, pills are going to be a great option in a lot of guys. The 4 FDA approved pills are the oral PDE5 inhibitors, your Cialis, Levitra, Sendra, and Viagra. Sendra is a new kid on the block. It's going to be more expensive, so I don't really use that in my practice for that reason. Pharmacokinetically, there are no major advantages for how it works in the body. Then you have Levitra and Viagra, and they work very similarly in the body as well, but Viagra is cheaper, so for that reason, I really don't use Levitra very often. And then it's really between Viagra, which is sildenafil, the generic, and Cialis, the generic, is tadalafil. And Cialis or tadalafil used to be cost prohibitive, and so I was using a lot of sildenafil in my practice. But now you can use medication assistance programs and actually get tadalafil for quite cheap. It's only a little bit more expensive compared to generic Viagra. So for a lot of guys, I start them off on Cialis because it lasts longer in the body. So it can last in the body for up to 36 hours for some people, versus Viagra, where your window of opportunity is really 4 to 6 hours. Now, the side effects of any of these medications can be headache and vision changes, heartburn, sinus congestion, facial flushing, sometimes muscle aches. And so if one person has side effects with a medication like Cialis, well, those side effects may stick around in the body longer than they might with Viagra. It's not that one of these medications works better than another. I have some patients that say Viagra works better. I have others that say Cialis works better. I have some patients that say they don't have side effects with one and they do with the other. So you can try a variety of these different medications. And the good news now with medication assistance programs, you can really get the generic Viagra and generic Cialis for quite cheap. In terms of other options, and you can use all of these options in combination with each other, which is great too, is a penile constriction band. And these bands can be used, let's say someone says, okay, well, I take Viagra, I can get a great erection, I just have trouble maintaining the erection. That's where these bands can be very helpful, because once a person has an erection, he puts this band around the base of the penis here, and it actually collapses the veins so that the blood stays in the penis. Now, the thing with the band is they can be uncomfortable if they're too tight. So the trick is to get one that's tight enough that constricts those veins from leaking blood, but not too tight that they cause discomfort. But I think the bands are actually very underutilized. You can get them online. You can get them at a pharmacy like New Cara Pharmacy. They can help order them for you as well. Then we have a vacuum erection device, and this one is battery powered. There are other ones that are manual. I think some of these vacuum devices can be a little bit cumbersome, and there are so many parts that it becomes overwhelming. You don't know how to use it. So I think this is a pretty good model here. This one's by Jasiva Medical. It's battery powered. It's very few parts. This comes undone here, and really that's about it. So what you do is also comes with water soluble lubrication, but you put some lube on that area because you want to get a good seal of this vacuum pump at the base of the penis here. And then you push this button and it creates a suction where it brings blood into the penis. And then this band here would be around the base of this vacuum device. And once the penis were erect, then you would just move this band, you would slide this band onto the base of the penis to keep the blood in. Sometimes you can actually use this, or oftentimes you can use this vacuum erection device just to help stretch out that tissue. Let's say you're not using it for sexual activity, but you just want to get blood flow in, you want to stretch out the tissue, exercise the tissue, then you don't have to use the constriction band. You can just put this around the base of the penis and kind of bring blood flow in and then take this off. But if you're trying to have, engage in sexual activity and you don't put the band on, then all that blood is going to go right back in the body. You can also use the vacuum erection device in conjunction with the pills. Other options to restore sexual health are going to be injection therapy. So this, for example, would be something like Trimix. It's an injectable medication. It combines 3 medications to help with erections. And the needles are actually quite small. They're insulin needles. And so what you do is before, this is used on demand for sexual activity, about 10 to 15 minutes before you want to be sexually active. You just clean the side of the penis here at 10 or 2 o'clock with an alcohol swab. Draw up the medication. We start at a very low dose and slowly work the way up. So I'll usually start with Trimix at maybe 20 units if the patient hasn't used it before. Okay. So clean the side here, and then you put this in all the way. You hub the needle and inject the medication, and then you hold pressure on the side of the skin there for a few minutes to prevent a hematoma from forming. This is going to work better than the pill options. The injections don't take as long to take effect compared to something like Viagra or Cialis, and it's going to be really useful in, let's say, someone who had their prostate removed and wasn't able to have a nerve sparing approach. For the pills like Viagra or Cialis to work, you have to have good nerve function for that nitric oxide pathway to work. And so if there isn't good nerve function, the pills really aren't going to work. That's where the injections can be helpful because they don't rely on those nerves to release nitric oxide, and they can be helpful in people who weren't able to have a nerve-sparing prostatectomy, or let's say big pelvic surgery like the bladder was removed, or big colorectal surgery as well. And then we have a penile implant. So unlike the vacuum device, the penile implant is completely concealed inside the body. This guy here actually has a penile implant, and you have a cylinder in each erectile body here that's customized to fit the size of the penis. And then you have a pump that sits in the middle. So you have testicle, and then pump that sits in between the testicles. And then you have a reservoir that sits in the body, usually in the pelvis here between the anterior abdominal wall and the bladder. When the man wants to get an erection, he just pushes this pump here in the scrotum, and he's physically transferring fluid from this reservoir that's body temperature salty water through the pump and into the cylinders. And then you can't overinflate the device when the device here is fully rigid. You just won't be able to push the pump anymore. It can stay up for an infinite period of time. Well, not an infinite period of time, forever, how long the gentleman is interested in having it inflated. And then there's another small, tiny button that sits right on top. Push that, squeeze the penis like so, and the fluid moves, empties from the cylinders, goes back into the pump, and then back into the reservoir. And in the natural state, in the flaccid state, this pump is actually very natural appearing. You wouldn't even be able to tell the person had an implant in place. So let's recap here. A lot of different ways that we can treat erectile dysfunction: pills and constriction bands, vacuum device, injection therapy, penile implant therapy. There's a medication that you can put in the urethra. I don't use that one that often. It's called Muse because it can cause some penile pain and is actually quite expensive. So for the cost reason, I typically don't use it, and the injections are gonna work better than that medication, but that is also an option for some people. And then, pelvic floor physical therapy. The pelvic floor muscles are really important to get erection. So I'll send some guys to see a pelvic floor physical therapist, and sex and couples counseling can also be helpful. So we use all of these, sometimes together, sometimes in some sort of order, depending on what the quality of life goals are for a patient sitting across from us. Let's talk specifically about erectile function after prostatectomy. Erectile dysfunction after prostate removal for prostate cancer or radical prostatectomy is likely due to a variety of factors, including nerve damage, as the nerves responsible for erections sit on the prostate and can be damaged during surgery, even when the nerves are spared. It may take up to 2 years for return of maximum sexual function after prostate removal as nerves try to recover. Now, I used to hear this phrase, use it or lose it, when it came to sexual health, and I don't think I ever really believed it until recently. But it is true. In fact, no truer words could have been spoken. Like any part of the body, if you don't use it, like if you don't lift weights and maintain your muscles, you will lose muscle mass. And really, that's the same case with the penis. Additional damage can occur when the penis remains flaccid for a long period of time due to lack of well-oxygenated blood to the erectile tissue, which can cause the tissue to lose its flexibility and form scar. For this reason, we advocate for early intervention in order to optimize outcomes when it comes to restoring sexual health and preserving penile length and girth. There are many different penile rehabilitation programs out there. There's no great evidence to say that penile rehabilitation will get the person back to what their function was before radical prostatectomy, but it can only help, and it really puts the control back in the patient in terms of trying to exercise the tissue and maximize function. Penile rehabilitation refers to improving erectile function so that erectades like medications and vacuum pump are no longer necessary. The role for penile rehabilitation with pills, injections, and/or vacuum pump to enhance return of sexual function is unclear, and there is no ideal regimen. Penile rehab should be tailored to the patient and his goals, motivation, ability to afford various therapies, relationship status, and other medical problems. And the optimal strategy likely will involve several treatments. In terms of oral medications, you may decide to take, or your patient may decide to take, a phosphodiesterase medication scheduled or on demand prior to sexual activity. There's no evidence that one works better than another, whether you take a Cialis every day or whether you take it on demand, for example. These medications will only be successful in those who have had some type of nerve sparing procedure, and response rates increase with time after prostatectomy as the nerves are given more time to heal after surgery. So some sample regimens for using oral therapy might be a nightly low dose sildenafil, like 25 milligrams, or nightly tadalafil, 5 milligrams. An on-demand dose is going to be a higher dose of sildenafil, for example, 50 to 100 milligrams on demand before sexual activity, or tadalafil, something like 20 milligrams. In terms of penile injections for penile rehab, you may decide, or your patients may decide, to perform penile injections. This therapy does not require functional nerves to cause dilation of those vessels. A sample regimen might be administering penile injection with alprostadil, which is Edex or Caberject, or Trimix, which is that combination of 3 medications 3 times a week. And then a vacuum erection device can also be used. A vacuum pump may help reduce loss of penile length and girth. And I would recommend using a vacuum pump without the tension bands unless you're using it for sexual intercourse. So a sample regimen starting 1 month after prostatectomy might be using a vacuum erection device daily, inflating the device for 2 consecutive 5-minute periods after a brief release in suction in between inflations, and holding off on using the tension band for the first month. Folks, we have an incredible opportunity to make a meaningful difference in the lives of men who have had surgery or treatment for cancer, especially when it involves their pelvis. Sexual health concerns after something like prostate cancer is common and expected, and we have to acknowledge that in our patients. The other thing is that we have so many tools in our toolbox to help restore function. In fact, there are very few men in whom we can't restore function. It is our jobs to educate our patients on all of these options and to re-educate them on all of these options whenever that person wants to talk about sexual health, as their quality of life concerns may change with time and changes in situation. We have to empower our patients and empower their partners to take control of their sexual health. And I hope this helps you along that journey to educate yourself so you can better educate your patients and their partners. Here's to providing comprehensive sexual health education and care to the important members of our community.